Welcome back, guys. Now let's discuss about gate control theory. Now this gate control theory is proposed by Ronald Melzack and Patrick Wall. Sir, what exactly is this gate control theory? Gate control theory tells us that the transmission of pain signals, the pain is getting signaled, right? The pain signals are going through the first order neurons, second order neurons, from the second order neurons, third order neurons, the pain signals. You can modulate them. You can stop the pain signal so the person will feel less pain, or you can decrease the pain signal transmission. Let's see here. The transmission of pain signals, you can modulate them. Where? At the level of spinal cord. In the level of spinal cord, which neurons are starting? Second order neurons. So, in brief, we can say, you can inhibit the second order neurons. If you can inhibit the second order neurons, the pain signals are not going to the thalamus. So, the person cannot feel the pain, or the intensity of pain you can decrease. So, the transmission of pain signals can be modulated at the level of spinal cord by a non-painful stimulus. How you can inhibit the second order neurons? By giving non-painful stimulus. Have you ever wondered, like whenever you are having pain, you will ask your friend or your mom or your sister to give you the hot pack or the cold pack, or they will do the massage. That massage will relieve the pain. That massaging will actually decrease the pain. You will feel relaxed, right? So how actually the non-painful stimulus like hot pack or cold pack or skin stretching, skin rubbing, massaging, how they actually decrease the pain? Let's see now. See, here are the first order neurons. This is the first order neuron in the pain pathway. Now see, these fibers, which fibers? These are the first order neurons, which are C fibers. These are free nerve endings. The free nerve endings of the first order neuron. Now when you stimulate here, the first order neurons are activated. Now the first order neurons are carrying the pain information. Now the first order neurons will activate the second order neurons. Now the second order neurons will activate the third order neurons, and from there the pain information is going to the somatosensory cortex. We already know that. Important point here is, see, this first order neuron, it's synapsing onto the second order neuron in the spinal cord. Not only that, see, this first order neuron, they will synapse onto inhibitory interneuron. Inhibitory interneuron. Now, let's talk about the non-painful pathway, non-painful stimulus. Whenever you give the non-painful stimulus, like touching the skin, rubbing the skin, like stretching the skin or massaging, that will stimulate the A beta fiber. Now, when you stimulate the A beta fiber, now this A beta fiber is activated. Now this A beta fiber is going to do what? See, it's going to synapse onto inhibitory interneuron. Now what is happening to this inhibitory interneuron? Now this inhibitory interneuron is activated. When you activate the inhibitory interneuron, what is happening? See, the inhibitory interneuron is going to release GABA onto the second order neurons. GABA is the inhibitory neurotransmitter. Now that inhibitory neurotransmitter will cause the hyperpolarization of the second order neurons. So the second order neurons are not getting depolarized. They are not producing the action potentials. So the information is terminated here, or the pain pathway is terminated here. Why? Because the second order neurons are inhibited. Who inhibits the second order neurons? Inhibitory interneurons. Who activates the inhibitory interneurons? A beta fibers. Why the A beta fibers are activated? Because of the non-painful stimulus. So massaging, hot or cold pack will stimulate the A beta fibers. They will stimulate the inhibitory interneurons. So they will inhibits the second order neurons, or the afferents, or the ascending tracts in the spinal cord. So that's what we have discussed. So the pain signals can be modulated. So modulation here, it's like inhibition, like pain signals can be decreased at the level of spinal cord by non-painful stimulus, by hot rubbing, like skin rubbing, hot or cold packs. Now let's see the first order neurons carrying the pain sensations. The first order neurons which are carrying the pain sensations. Usually the first order neuron which is carrying the pain sensation, it will go there, it will go into the spinal cord. In the spinal cord, which region? Dorsal horns. The first order neuron is going to end, right? The first order neuron ends in which part of the dorsal horn? The first order neurons are ending in a part called as a Substantia gelatinosa. So the first order neurons carrying the pain sensation sends in Substantia gelatinosa of spinal cord. Okay, so from the substantia gelatinosa, second order neurons will start. Okay, they will cross and they will ascend up. After that, let's discuss about something called as acupuncture. Okay, so needles are inserted in certain points of the body that, like needle therapy will give you some analgesic effect. So how actually this works? See, whenever the person is going through the acupuncture, this kind of treatment, that traditional Chinese medicine. Now acupuncture, what it will do? So acupuncture is going to produce certain chemicals called as endorphins, dynorphins and enkephalins. Okay, so endorphins, dynorphins and enkephalins, which are produced where? They are produced in the periaqueductal grey matter. Now these are analgesic substances in the body. How means? These substances are analgesics. They will decrease the pain signal transmission. They will decrease the pain. Okay, that decrease the pain by producing. See, with acupuncture, these substances are produced that decrease the pain. These are the analgesics. Now, whenever you are in stress, okay, whenever you are in stress, for example, imagine yourself as a soldier. You are fighting a war. Now, you got hit by a bullet. Okay, you had a bullet injury. Now, if you had a bullet injury, are you going to sit and worry about that bullet injury? No. Even most of the soldiers, they doesn't even know that they had a bullet injury. Okay. Later, after lot of time, after running away from that area, fighting and coming out of that area, then they will realize, okay, they had these injuries. So, whenever you are in stress, okay, whenever you are in stress mode, you won't even feel the pain. Okay. So, why, sir? See, stress is going to produce something called as endogenous cannabinoids. So, these endogenous cannabinoids are produced. These endogenous cannabinoids are the analgesic agents. They are the painkillers. So, during stress, you won't feel the pain. Why? Why? Because production of endogenous cannabinoids in the body, they give the analgesic effect. Okay. So, what we have seen is a gate control theory, and why acupuncture causes analgesia and why stress will cause analgesia, we have discussed in this video. Now, here itself, there is a small thing. See, temperature. Temperature is going to stimulate which receptors? Thermoreceptors. How many types of temperature are there? Temperature, it's of two different types: cold temperature, warm temperature. Now, whenever there is cold temperature is going to be carried by, cold sensations are carried by A delta fibers. This is delta, okay? A delta fibers and C fibers. A delta and C fibers. Remember, like cold means AC. So, A delta fibers carry both. A delta fibers, already we have discussed. A delta fibers carries the fast pain, epicratic pain, acute pain, sharp pain. In the same way, the cold sensations are also carried by both A delta fibers as well as C fibers. But warm sensations are carried by C fibers only. C fibers only. A delta fibers and C fibers, like here you have the TRPM channels. Remember, M for moon for cool. So TRPM channels, they are going to be present on the pathways where the cold sensations are being transmitted, and TRPV channels. Okay, TRPV channels are present on the C fibers, which are carrying the warm sensations. So it's a very small topic. Okay, cold sensation, direct questions are cold sensations are carried by A delta fibers as well as C fibers, and warm sensations are carried by C fibers. Okay, which channels are present on pathways where cold sensations are being transmitted? It is TRPM channels and TRP5 channels are present. Okay, TRPV channels are present on the fibers which are carrying the warm sensations. Okay guys, hope the video is helpful. Thank you.